In this episode of the Informed Pregnancy Podcast, we interviewed Dr. Samuel Kim from Heal.com, a service that I use personally and love. Heal.com is also an Informed Pregnancy sponsor.
Doctor, give me the news. I got a whole lot of questions for you. This kid's gonna test my will. I got a lot to learn and my baby's due.
Welcome to the Informed Pregnancy and Parenting Podcast. I'm your host, Dr. Elliot Berlin, prenatal chiropractor, filmmaker, and labor doula. I'm joined by today's co-host, Angelica Ortiz. Angelica has an undergraduate degree in neuroscience from University of California, Riverside, and is embarking on a chiropractic career with a focus on prenatal and pediatric care. Welcome back to the podcast.
Thank you. I'm happy to be here.
Our guest today is Dr. Samuel Kim. He was born and raised in Los Angeles, California, and he studied biology and economics at the University of California, San Diego. After working in cancer research, Dr. Kim went on to receive a dual MD MBA degree from the USC Keck School of Medicine and Marshall School of Business, and has been a practicing pediatrician since 2009. Dr. Kim lives in Los Angeles with his wife and their two young children. Welcome to the podcast.
Thank you for having me.
Pleasure. Dr. Kim, you work with Heal.com, the on-demand doctor that does house calls for both adults and kids, which my family and I love. You are our new doctor. Not you individually, but Heal.
Yes.
I'm blown away by Heal. I'm very excited to have you today because I want to learn more about it, both from the patient side and as a doctor from the doctor's side. And I'm really excited to share it with our listeners because our demographic of growing families with the kids, it's so hard sometimes to get out of the house and to go to a pediatrician's office where you're sitting around with a bunch of sick kids sneezing on your kid, even if you're just there for a well visit, checkup. And if you have more than one kid, you got to drag them all in the car. It's so hard to do. It's getting difficult to afford. And all of a sudden, it's like in the age of Uber and Lyft, the doctor comes to you. It's amazing.
It absolutely is. And in this day and age of on-demand for everything, whether it be food or for other services, I think the doctor house call coming into play is just, it's not revolutionary by any means because it's been done before in the past. But definitely in this healthcare climate, I think it's a good thing that we can offer for our patients, and it really delivers a high quality of medical care that people are seeking.
So let's take a step back. I mean, you've seen movies that, in the classic movies, that when someone needed a doctor, they would call the doctor. And it wasn't call the doctor, when can I come in? It was call the doctor, and they would come into you, and they'd have that little black bag. I don't even know what was in there in early medicine times. I'm guessing they had like a thermometer to see if you're going to live or die, and then maybe some alcohol or aspirin to help you stay comfortable until you lived or died. And things have evolved quite a bit from there. But while medicine has evolved technologically and we have major innovations in pharmaceuticals and surgical procedures, the way healthcare has evolved, the way the interaction has evolved, user interaction, it's kind of gone downhill in a lot of different ways. That doctor, up until recently, didn't come to us anymore. We'd have to go to the facilities. I feel like the specialization sort of, it started off, you just had a family doctor. They treated your whole mind and body. And then all of a sudden, we have specialist bone doctors and blood doctors. And then it gets even smaller. It's like we have bone doctors, but we have like just a thumb guy. Who's your thumb guy? And it gets really specialized. And of course, what everybody's talking about in the news when it comes to healthcare is affordability and accessibility. It's getting really expensive. And a lot of people are squeezed out financially from being able to see good doctors, and sometimes don't. They just won't see doctors that they need to see.
Yeah, I think that's a great point. And historically speaking, when you think about the good old days and the nostalgia of medicine in the past and how the doctor used to come to your home, why that basically kind of phased out was that medicine became more centralized. You had the hospitals where the innovations were occurring and the technology advances that you were talking about in medicine really took a hold. And so it became a lot more centralized, and it became a lot more about accessing healthcare by the patients to those facilities or to those specific doctors. And then medicine as a whole in general has definitely evolved, and there is a need for, your hand orthopedist or versus your shoulder and your elbow, hematologist, oncologist. The wealth of knowledge that has been created in medicine over these past several decades has just been amazing. And that's why it's so hard for a physician to be that all-encompassing doctor, where as maybe their medical textbooks back in like 50 years ago was about 200 pages. Now I know from my pediatric medical textbook, it's
200 gigabytes.
Absolutely. Yeah, 1,000+ pages. You have trouble, putting your kids to bed, just open that book up and they'll be out in 2 minutes.
Books on tape.
Yeah.
Radiological pathologies of the chest. And so, Angelica, you're just entering the field of healthcare as a practitioner. And I remember when I was in your shoes, just so excited to, interact with people. What made you want to become a doctor?
I've always actually wanted to become a doctor, like just growing up when people ask, like, oh, what do you want to be when you grow up? And instead of saying like a singer or anything, I'd always say a doctor, because I always wanted to help people. And like my grandma was always sick growing up, so I would see the way that doctors treated her, or like how inaccessible doctors were sometimes. And it kind of inspired me to want to help people like her, and because it's a large population of people who, are suffering, but they can't see a doctor until 2 weeks from now.
Mm-hmm.
And that's why I was actually looking at the app last night, just to see how user friendly it is, and it is insane. It actually looks similar to Uber. You can see how far the doctor is from your house. It's really cool. Yeah. And I was telling a lot of my classmates about it today when I was in clinic, and they were amazed. They were just. I think that the app needs more awareness, because a lot of people would definitely utilize it.
Yeah. When I was going, just finishing my training, I was excited to. I also, from a very young age, I wanted to become a doctor. I don't really even know why. My grandma was pretty okay. She was hungry, so I should have been a chef. But when I was growing up, I just always felt like I was going to get involved in healthcare, and I just wanted to be around people and help people and take them when they're not feeling good and make them feel better, and develop that relationship. The old relationship of family doctor felt really cool to me.
Right.
But then as I got out into practice, and it was all okay, so if you're going to take insurance, insurance covers for chiropractors probably about 3.5 minutes per visit, 5 minutes per visit. You can't even get a good sense of what's going on and how to treat it. It just becomes very factory-like. You don't have that family relationship from the doctor's side. So I imagine I am, because I am a doctor and I am a patient. I feel it on both sides. Healthcare from the patient perspective is it's hard for me to get appointments when I need appointments. The insurance is a mess. From the doctor's side, I want to spend more time with my patients. So our thing is we stop taking insurance, but that means you automatically limit yourself. You knock out a whole bunch of people who you really want to be working with, and you can't work with them. So talking about full circle, this almost reminds me of my kids got the Nintendo Wii, right?
Yeah, I love it.
And my son was like, Dad, let's play tennis. Let's play tennis on the Wii. I'm like, okay, tennis. So he gives me this little tennis racket, right, that has the controller in it. And these balls come flying at you, and you're running around the living room just swinging at these balls. I'm starting to build up a sweat. The next morning, I had tennis elbow. Okay. But as we're running around, and it vibrates when you hit the fake ball. And he's like, Dad, isn't it cool? Doesn't it really feel like you're playing tennis? And I'm like, why don't we just go play tennis? The whole point of video games, we could sit on the couch and do nothing and be entertained. It just came so full circle that we're actually playing tennis again. In a better note, what's happening with HEAL is the benefits of old school medicine are being blended together with the advantages of new school technology. And I just used them on Monday, and literally my doctor came into the house with the little black bag. Of course, his had a pulse oximeter and a little tablet computer inside instead of tablets of aspirin inside. But it was amazing. I started using HEAL because I work insane hours. Angelica knows I work in St. Alex.
Yeah.
So my blood pressure was starting to fluctuate, and I needed to see somebody to see if I needed to alter the medication or not. And my doctor works 9 to 4. I could never get there. And then when I finally did get a little break, I'd call and he's out at lunch or he doesn't have available. I could never get to and it was getting to be like, what am I going to do? I really need to change my medication. I'm going to pass out. I was losing weight. My blood pressure was going down, and I needed to decrease my meds. And that's when I was like desperately searching for a doctor, and I don't even know what prompted me to do it. I typed in doctor on demand. Like, where can I just go to get a doctor? And Heal came up, and I was like, what is this? And my wife was like, you are not going to use that app and have some random doctor come to the house. I'm like, okay, you're right. I'm not going to do it. So when she wasn't paying attention, I had them come to the office. Okay.
Clever.
I was a little skeptical, and it was the most amazing experience. It was, first of all, it's like 8 a.m. to 8 p.m.
Yeah. That's
Nice
insane.
long hours, 7 days a week, including
Weekends.
Weekends,
holidays,
holidays, you
it's
name
Wait,
it.
holidays also.
Holidays as well. Yeah.
Wow.
It's amazing. Eat too much turkey on Thanksgiving? Still get a doctor. So the hours are what got me. And when the doctor came, I was a little skeptical, and it was a great experience. Super nice, friendly doctor. 2 people came. A lab person came, and the doctor came. They evaluated me. We did a history and an exam. And all of a sudden, like, he typed into his little tablet, and he's like, okay, your prescription's waiting for you at CVS. Done.
Wow.
How long did that
Convenient.
interaction take you?
It took about 20 minutes.
20 minutes. And how did you feel after it?
I felt cared for.
Exactly.
I felt cared for. And then the crazy thing was, so I'm like, this is probably going to be $300. Because my doctor, you know, I see what they bill the insurance when I go there. When I go there, it's that much money. And it was $99.
Yeah.
And now you guys take my insurance, so it's $30. I feel like calling like every other day. Hey,
Weekly
will you
checkup.
come over? If you combine this with Postmates and my doctor brings me a pizza, it's heaven, nirvana.
I think you hit upon a lot of great points, is that all of us in the medical profession, I think wherever we started, we always had that core value of we wanted to help people in one way or another. And by doing that, by impacting somebody's health, that's something that nobody else can do except for our doctors. And so when you try to box a doctor in and tell him how to practice and tell him what he needs to do with his patients, it takes all the joy out of it. It takes all that passion that you had growing up and all the passion that you needed to get through all those textbooks and those countless nights of just studying nonstop and, you know, caring for patients in the hospital. So, and when you get out, you're basically left practicing medicine the way somebody else tells you to, because if you don't, then you're not going to get reimbursed. You're not going to get paid. You can't take care of your own family. You can't keep your doors open to treat patients and to give the care that your patients are so desperately seeking. And so knowing that and knowing that this healthcare, it's in crisis right now, as we all know. And it's just about really taking it down to the bare bones. We send a doctor to our patients to treat them. That's it. They don't have to worry about, you know, their lease. They don't need to worry about staffing. They don't need to worry about malpractice insurance. They literally go into that interaction with just a focus on you.
So if I shift over
nice.
from patient mode to doctor mode, what you're saying resonates with me a lot.
Yes.
First of all, we have like a $18,000 overhead between the lease on the practice and then having receptionists and employees and billing people and all the other things that you have to have, the phone service, the internet service, the music service, down to the magazine subscriptions and the linen and the needles and it costs a lot of money. So before you can make a penny, you first have to make back all of that. And then the other thing is managing all of that, the amount of time you have to put in to manage those people in human resources and to have, you know, team building meetings. And I like them, but it just takes up a lot of my time before I even get to see a patient. So I have to expend a lot of money before I collect a dollar. I have to spend a lot of time before I see a patient. For the doctor, the Heal model takes all of that off our plate.
Absolutely.
Which is really sounds great.
Yeah.
I mean, if I could just go to work and see patients and care for them and do notes and go home, it would be nirvana. Again, with a pizza. But you're wrong. A little veggie pizza, crustless.
Okay, gluten-free.
Mostly just roasted peppers.
But I think that interaction that you had with our heel doctor, and your doctor was Dr. Malk, and he's an amazing doctor.
He's great.
You have to understand the patient interaction, if it was supposed to be in the office, wouldn't have been any more time or any less time. It would have been probably like a 10 to 15-minute interaction. However, the way the patient feels and the way the patient feels cared for and going into a patient's home is a totally different game. And as a pediatrician, and you have kids too, correct?
Yeah, I have 4 kids.
Have you seen Big Hero 6 way too many times?
I don't get away from the office. I'm too busy managing all those people.
Yeah, well, Big Hero 6 is a great animated film, but I take the philosophy of Baymax. He's a main kind of part protagonist, and he's a healthcare provider. And he doesn't leave and he doesn't power down until you tell him that you're satisfied with your care. And so I think that's the whole premise of medicine in general. Like, it's not about customer satisfaction, but it's about patient satisfaction so that you feel good about the care that you were provided for, feeling that that doctor was vested in you and not just your disease or whatever they're treating, but you as a whole human being, as a person. And that, we are looking to our parents or our patients as partners in healthcare, okay? Without your agreement and without your full support of what we're trying to accomplish, nothing's going to get done. If we tell you to take medication and you don't take it,
right,
you're not going to get better. But if I told you, you are taking this medication because it will treat this, and this is what it does, and this is how you will feel, and you become more vested in your treatment, it's gonna feel phenomenal. Okay,
Yeah.
You become an active participant in your own health care, because I think a lot of patients have come away with this idea of like, heal me, doctor, heal me. No, it's about doctor. How can I help you?
Yeah.
How can I educate you? How can I help you feel better by you doing the right things as well? So it's that the amount of time that it takes to accomplish that, to build that type of rapport, it's not going to happen in a 5-10 minute session.
Right.
I know for adults, too, maybe not as much as for kids, but there's like a level of anxiety of just going to the doctor's office and seeing all those
Yeah, I was
instruments
just going to mention that, like
around.
white coat syndrome.
Yeah, the white coat syndrome, and just like getting there and having to wait, and then going into the inner chamber and waiting again and putting on some paper clothing. It's just all not very comfortable. But for the kids especially, they get a little anxious going there. They don't know if they're going to be poked or whatever. So to be home in the home environment, I find with the kids that it's much more calming for them.
Yeah.
Oh,
You come into
absolutely.
their space. And
Yes.
it's like you're the odd man out.
And they're welcoming you rather than you welcoming them.
Yeah,
It's-
exactly.
You
Different
hit
dynamic.
upon the whole premise of that house call, like the dynamics of it totally changes. It's not, hey, welcome to the doctor's world. Instead, it's flipped around, and basically the parent or the patient's like, welcome to my world.
Yeah.
We live by my rules under this home. Okay, so if I don't agree with anything, it's not going to go. So it's behoove upon the physician to come in and to build that rapport and to create that relationship and deliver the same type of healthcare that you would get in the doctor's office, okay, within the comforts of your own home setting. And
Right.
it's key. It's absolutely crucial, especially with pediatrics, but I'm sure it's the same with adults as well. And it's not just within your home setting for adults. It's like, hey, I'm a busy person. And, I don't get to take a day off just because I'm sick. So can you come meet me at the office? Absolutely,
Yeah.
we will.
And not only that, I think that going in as a physician and being able to see like the whole environment that your patient lives in is a really great diagnostic tool. You can
Absolutely. I get to see Fido and see how many goldfish that they have and what kind of scooters that they have and what kind of drawings are on their helmet. A picture is worth 1,000 words. And I think walking into a home, it tells us a lot and it helps us a lot, and I can engage my patients and my parents in different ways. Oh, hey, I just saw that, Rachel Ray cookbook that you have open on the kitchen counter, or, what kind of foods have you been cooking for your family? Any good recipes? How many, how much vegetables do your kids take in? Like, do you have any other ways that you can, get some more veggies into your kids? Because I'm curious as to how I can do that for my kids, So it's a much more personal level, instead of coming into a room saying, hey, I'm Dr. Kim, what's wrong with you? How can I help you? It's more about, it's very organic.
Dr. Malkin, when he came to my house earlier this week, he came around dinner time. And he's coming to check my blood pressure. And he totally made some comments, just suggestions about diet specific for blood pressure, dietary things you can do to help, which I feel like in general the medical model is sort of doesn't focus on that much. So he wasn't all about the meds. It wasn't just like, hey, here's some meds, go. It was more, he had some lifestyle observations just from coming into our home, and I thought that was pretty cool too. And I imagine also with do you do senior citizens?
We do.
So with them even more so, they're oftentimes taking a lot of different medications, and their environment can also play a role in their health. So being able to go into their environment and see what's going on.
Or just being able to see the medications. In the clinic, a lot of times I'll ask like a geriatric patient, like, oh, what kind of medications are you on? And they're just clueless, like, oh, I don't know. It has a red label on it. Okay.
And you guys don't, the doctors don't get paid by the patient.
No, not at all.
So if they spend 5 minutes or 20 minutes, there's no incentive to rush through the visit.
No, there's no incentive to see as many patients as possible. Each patient will get the acquired amount of time that the doctor sees fit, okay? As you get more and more comfortable with your physician, naturally it won't take as much, right?
Time.
Yeah, absolutely. Sure. But that initial, that rapport, that relationship building is so key. If you don't trust your doctor, if you don't trust what they're saying, then you're not going to get any better no matter how many medications that they give you. And I think just in medicine in general, we've gone away from this idea of like, hey, what are you doing in terms of your lifestyle? What are you doing for yourself to diminish the amount of stress, get the proper amount of rest, get the right amount of exercise, to get the amount of sunshine, I think we're just so focused on the next steps and the following day and our to-do list that we forget to be present wherever we're at. And so my chiropractor just who I saw just yesterday, and he's like, man, Sam, you're really tight. Have you been up and moving at all? And I was like, no, I've been sitting in a car for like 12 hours a day. And he's all like, well, you know what? You got to take the opportunity to get out and just stretch and do something. And because I felt that he was vested in me and knew what was best for me and understood my lifestyle and what was going on, he wasn't making any judgments about it. He was more saying like, hey, let's try to figure out a way where we can get you more active and moving, know? And so that's kind of the philosophy that I have whenever I go into a parent's home. I want to understand where they're coming from. And as a parent, I want to understand what is it that you want and how can I combine that all into the plan that I create for you and your child, And so it's much more about, hey, listen, I only give antibiotics when it's appropriate, but if a parent's asking me like, hey, I want to do something for my child, I will give them something to do that doesn't involve antibiotics and give my reasoning behind it, And it's, and the light comes on, parenting isn't intuitive. I think it's all by experience and after years, right? And how many kids do you have, Dr. Brown?
I think we're up to 4.
Are you done after this fourth one?
I don't know.
Okay.
Who knows?
But you learned how to be a parent on your own terms and in your own style, correct?
Yeah.
And so that's the different thing too. Every parent has their own parenting style. Every child is their own different personality, and you have to be able to juggle all those things and create an action plan that's geared for that specific child and family, And so, and that takes a lot more hand-holding and a lot more time than we're allotted in the office
in the traditional medical setting.
Yeah. Well, that's great because that probably creates more compliance, because you're educating them and, making a a plan specific for them, they're way more likely to be compliant.
Absolutely. And you give them a sense of peace too. Dr. Kim said that this would be 5 days of fever would be all right as long as it didn't go above 105. And I know what to do. He gave me some action items like I can do a steam shower, I can do Tylenol or Motrin, I can do all these things to help alleviate my child's discomfort. If I don't feel comfortable, then I will give Dr. Kim a call or I will call HEAL.
Yeah, and you guys will be back in 2 hours.
Absolutely. Hopefully.
Amazing. So, I have some natural questions. I'm still learning the limitations of, it's a relatively new platform. So I'm learning the limitations of what can I. You have, basically replaced for me, HEAL is my new personal physician, my general physician, and it's to some degree it's our kid's pediatrician, because it's just a lot more convenient to have HEAL come to us than to go to a doctor, and our experiences are great quality, very convenient. The records are all electronically focused, so they're centralized and accessible. Calling in prescriptions, we don't even have to. You just do it. Like magic device, the prescriptions just shows up at our pharmacy. So there's a lot of great things, and the fees are incredible. Like now that I have an insurance carrier that is accepted by HEAL, our copay is $30. I sometimes at Beverly Hills Physicians pay $30 to park the car. So it's just. In terms of affordability, I have a patient that's visiting from out of the country, and she doesn't have insurance here, and she needed medical attention, and she was really worried about having thousands of dollars of medical bills. So I'm like, just use HEAL.
Yeah, easy fix.
In a couple of hours.
Oh, here, download this app.
Yeah. Like, I want HEAL to do other stuff. So it's just medicine. So I have some questions about the natural limitations. Sure. First of all, you don't get the same doctor each time, and I think some people are okay with that. Some people aren't okay with that. How does that work? Does dispatch work? Can somebody say, I only want to see this doctor?
You can absolutely request the same doctor. It's all dependent upon their schedule, because none of us work 7 days a week, 52 weeks a year. So unfortunately, it's the nature of the beast right now. But as we continue to grow and as we continue to evolve, like I told you before, the end goal for HEAL is to create a continuity of care where a patient can see the same doctor over and over again, okay? And I'm sure you've been in different physician offices, the same scenario, like they have very qualified partners who will take over for them when they're not available. But for the most part, when it comes down to the continuity of care, which is very important in medicine, we are really working hard to make sure that you have a HEAL community physician, whether it's a family practitioner, an internal medicine doc, or a pediatrician within your community that you can see or your kids can see on a regular basis. That's something that's definitely our goal and something that we're working towards right now.
But thanks to technology, there's continuity anyway.
Correct.
Whoever comes in, they have access to everything that's happened up until this point.
Yeah, and interesting enough, HEAL is, we look at HEAL as a technology-focused startup, okay, that delivers high-quality healthcare. So if you don't know the background of HEAL, it was started by our CEO, Nick Desai, and our Chief Medical Officer, Dr. Dua, and they're a couple, and it was through their negative healthcare experience in relation to the delivery of healthcare to their kids that they decided there's got to be a better way and a way to change how healthcare is delivered, and where we can get a caring doctor to appropriately treat our kids, or anybody for that matter, in a more convenient manner. So that's how it started up, and it's just blown up in terms of the capacities. When you talk about the technological aspects of it, we are building up all these proprietary software and all these applications in-house,
Wow.
And so that HEAL app that you saw, that was through hundreds of hours of engineering and focus groups and figuring out what to do and how to best engage the patient.
It's really user-friendly.
Yeah, and that's the whole point. Whether it's the delivery of healthcare, with a doctor to your home, or whether it's the user interface on our application, we've always thought about how is it going to be the most beneficial for our patients, and that's it.
That's great. Now I have a question. What if, or actually, Dr. Mellon, you mentioned that when you had your first visit that they brought a lab guy. Like, what if you need like x-rays or lab? Like, how does that get incorporated into a person's home?
So what happens is that we have a licensed medical assistant who is also a licensed phlebotomist as well. If we need to draw labs, we'll draw labs within your home, and we'll drop it off at LabCorp for you. Okay,
Wow.
so we have partnerships with laboratories.
Which labs? I mean, is it all labs? Or?
No, it's just for right now LabCorp.
No, but I'm not saying
I'm
which
sorry.
facilities, which types of tests.
Oh yeah, any types of blood draws. If it's indicated by the physician,
They do blood.
they'll
urine
recommend it.
testing as well,
As a
or-
pediatrician, I've tested for urine, I've tested for strep throat, I've tested for a CBC. These are
So
all.
you do all that in the house and then have it lab processed, then we get the results. How do you get the results?
They're integrated into our EMR system, and then we will follow up with the patients directly.
When you
Wow.
have them?
Yeah.
Yeah. it's
Is
really-
that
that's-
within the $99 fine or
Oh yeah,
fee?
yeah. None
Sorry,
of this
not
is.
fine.
I
Fine.
think.
Shame on you. We must poke you and take your blood and fine you.
I think the fee for the laboratories are all dependent upon what your insurance carrier will cover. That's outside of our realm and our control. But in terms of ordering and procuring the appropriate labs, that's all on us.
Wow.
Yeah. So
That's impressive.
What are the limitations? Well, in terms of types of visits. So we know you do general and internal and pediatric care. So if the kids wake up with a cough, a cold, a fever, hit it. Did I just see recently that there's a button that says just come now?
there is an ASAP feature that we do have in our application that we're seeing that, if you want a doctor to the best of our ability, we will send one to you as soon as we can. So once again, another component of our business that we're trying to vet out right now, and we're really trying to see how much more we can do for our patient in a more timely fashion. So,
Right. So if my kid wakes up sick at 7:30 in the morning, and obviously is not going to go to school, going to be home all day anyway, I might, instead of trying to pick a time, I might as well just hit come as soon as you're available.
yeah, absolutely.
25
And
minutes,
you'll
it might be
you'll
an hour
be
and a half.
speaking with our customer service representatives or our support staff, and they will basically put you through and figure out a time that's most convenient for you for us to come and see your.
I guess since
Child, yeah.
most of the listeners haven't seen the app, it's
Yeah.
kind of neat. You build a profile for yourself, very simple to do, and for other members of your family. When you open it up, you sort of put in who it is that you're seeking a doctor for, and then a very brief description of what it is that they'd be coming for. So I guess you guys are prepared for what it is. You send the right person with the right materials. And then you pick a 2-hour window, usually same day.
Yeah,
You
absolutely.
just pick a 2-hour window for later today. I always do the ones before or after normal business hours.
Uh-huh.
And, I'm home doing homework with my kid instead of waiting in a waiting room. And then when the doctor comes in that 2-hour window, it's the 10, 15-minute visit, and then back to doing homework. It's just, I still can hardly believe it's true.
Yeah,
It's really,
more convenient.
with
for the
medicine
doctor.
going so down the crapper, in terms of affordability and accessibility and experientially, this is just, it's really hard to believe that it's true.
There's hope.
People are going to think this is a April Fool's Day.
Yeah, they will. You should launch this
Yeah, right,
podcast on
on
April
April Fool's.
1st.
This cannot possibly be true. What about other things like, so is there gynecological care or obstetric care? Like when you get slightly more into the specialties?
Yeah, right now we're focused on delivery of primary care. But in the near future, we're hoping that we will be able to create more, synergistic relationships with other more subspecialties, whether it's OB-GYN or, our cardiologist, whatever the case may be. And alluding to where medicine is going, we always talk about like the technological innovations that are occurring. Everything's becoming a lot more, Bluetooth based or Wi-Fi based. And so you can be checking your glucose on a daily basis, and that information can be streamed directly to your endocrinologist, basically tracking how tightly is your sugar controlled. Or you can go to an offsite location and get your blood pressure checked there, and that data will be transmitted. These are the types of innovations that are occurring in medicine today. And we are trying to prep ourselves to be ready for that and to accept and adopt those types of technologies. So once again, that we can deliver better care to our patients. And so that's the thing about Heal. Even though we are in the core business of delivering high quality care to our patients, we're adapting to the times and figuring out how can we better do that without depending upon, the hospitals and the subspecialties and all these different, services. Like, how can we do that and create a home environment that's conducive to really monitoring your health and letting the patient be a part of it, right? I think that's what I wanted to be my main point. We are coming to you. We want to help you be a partner in your own health. And instead of me telling you what to do, I want you to be a proactive participant in changing your lifestyle, okay? Doing certain things with your diet, okay? About really thinking about a patient's psyche and their emotional health and well-being, I think it really helps the doctor do their job appropriately. And to that point, I got to tell you, I just had one of my pediatric colleagues, Dr. Thomas Yu, an amazing guy, his pedigree you wouldn't even believe. He was able to diagnose a very rare condition called Lee-Fraumeni syndrome for an adolescent patient of his, okay? And it makes, yeah, I had to look it up too.
I read a lot of books. And I'd never heard of that.
And it's one of those things that we rarely see. But this guy took the time, took the effort to really dig in,
Wow.
and find out an extensive family history, kind of put the puzzle pieces together. And he's like, hey, this is what I think you have.
Wow.
Can you imagine?
Impressive. Yeah.
They were so impressed and they were so thankful because nobody else had been able to take the time or the effort to really figure out what was going on with his patient. And he went in there and did his job as a doctor and made a huge impact for that family, and it's just amazing.
And I bet that makes it so much more fulfilling for the doctor also,
Yeah.
Oh, yeah,
It's gotta
absolutely.
be. Just not spending all your time dealing with insurance companies and
Right.
billers and tell me some of the main things people call for adults and for kids, like maybe the 5 or 6 really common things that they call for adults and kids. How do we use Heal best? What types of things?
I think for your pediatric patients, it's always going to be this, your run-of-the-mill cold. My child has a fever. My child has a sore throat. My child seems to have the flu. I think my child rolled their ankle, or any multitude of things. But it's just like the common things that
When you say roll the ankle, so do you do sort of first aid care there? Or
we'll evalluate.
you evaluate, but in terms of
absolutely.
if they need,
Yeah.
obviously you're not going to do setting bones and casting.
No. I'll leave that up to the orthopedist. But if there's a question of whether or not it's a bad sprain versus a fracture, and there's no visible deformity that you can tell right away, it may need, the special attention and kind of the clinical acumen of a physician to come and just evaluate. If it needs a higher acuity care, then we'll send to the appropriate person.
Do you do any procedures in the home?
Sure. I was just disimpacting a patient's ear 2 days ago. It's not all that bad, but it's like disimpaction of cerumen from a patient's ear of mine. Doing a dermabond of a small laceration. I've had to staple a laceration of the scalp once. There are a lot of things that we can do that allow us to function similar to an urgent care, but once again, we're still growing. We're still trying to figure out our limitations and try to figure out ways to get around them. But yeah, we're hoping that we can offer the full suite of services that you would find within your doctor's office. And, those will be rolling out soon enough.
How about vaccines?
Vaccines right now, as you know, I'm the medical director of
Yes.
pediatrics. I want to be very, very clear and be very careful about the rollout of vaccines. I want to have all my ducks lined in a row before I pull the trigger, okay? But very soon, over the next several months, we will be offering the full suite of well child care visits.
Oh, wow.
Along with the vaccines, the vision screens, the hearing screens, our autism screens, whatever we can accomplish in the office, I feel like we can do in a patient's home. It's just a matter of doing it appropriately, doing it safely, and doing it effectively. And so, as doctors, I don't as a doctor, I don't do anything halfway. It's all the way or nothing
Not
at
at
all.
all.
So, yeah.
Wow. Angelica, do you have any other thoughts or questions?
No, not right now. I think I just want to note that, like, in the future, like going forward, when you are able to have like an orthopedist or a OBGYN like come into the office, that would make a huge difference in a lot of people's lives, because it would take out like the prerequisite list that you have to go through to see a thumb specialist, as we mentioned before. So that can make a huge impact on a lot of people's lives.
But even though you don't do OB right now, if a woman is pregnant and wakes up with a cold or flu or something like that, they can still use Heal.
Absolutely.
It's just that you're not taking care of the baby. You're not coming and doing ultrasounds. Correct. You're not delivering babies. So is that in the future? Are we going all the way back to home birth?
How about when I get a director of obstetrics and gynecology, I'll let them field that question.
Oh, that's okay.
But as of right now, no. That's there's a lot of there's a lot of limitations. I think there's a lot of barriers to that as well. And of course, once again, it's about the level of comfort our practitioners have in terms of delivering the right care.
Sure.
And so,
I wish you guys would have vets.
I know. I was thinking.
Like seriously, for my dog to go to the vet?
You talk about somebody who doesn't take any insurance and who knows what they're doing. It's a vet.
It's a vet. Yeah, my dog is jealous. You guys come to take care of us, but we have to take him over to the vet.
Yeah. So, I think going back to your original question, the doctors, first and foremost, we all take the oath of Hippocrates, and we do no harm. And so, once again, we may seem very, very cautious and a little bit apprehensive about a lot of things, but it's because a good doctor knows their own limitations. I'm sure you can attest to this as well. You know what you know. You can treat what you can treat. But if you don't know something, you're going to find the right people and the right information and gather all that together before you go ahead and treat that patient with a better understanding of what their ailment is.
Sure.
That's the same thing for doctors as well. I think the good ones will let you know, okay, I know what I know, but I also want you to know that I don't know everything.
Right.
Because a doctor who tells you that I know everything and I can treat everything.
It's trouble.
Yes, exactly.
Yeah.
That's a doctor
it's
you
want to avoid. It's one of the hardest things to and most powerful things you could do is be like, I don't know. Yeah. I remember at the beginning I felt so dumb when people would ask things. I'm like, I don't know. Let me go look on Google real quick. But now it's like you said, you know what you know and you know what you don't know. Yeah. And it's great to be able to say, I don't know.
Exactly. And because you've already created this like personal relationship with your patient, even if you don't know, it'd be so easy to follow up, and it would mean like so much more to them.
Absolutely. Can you imagine 65 doctors talking amongst each other? Hey, I had this interesting case. I'm not quite sure. Can you help me out? Right. I'm texting with Dr. Yu, every other day, like, hey, what do you think about this?
So you guys are all connected. The team of Heal Doctors is connected.
Why would we not be? Yeah. Why would we not be communicating with each other? Why would I not be, enlisting the help of a Heal doctor like Dr. Brian Minton, who was a Stanford hematologist oncologist for a case, that involves maybe a factor V deficiency, Why wouldn't I be contacting Dr. Chona, one of our new Silicon Valley pediatricians about an emergent case for a child who, is having some tachypnea, Why would I not be depending upon these great colleagues of mine who have their own expertises and their own clinical wealth of knowledge? Why would I not depend upon them if it's going to be beneficial for my patients?
That's great.
So.
Well, now that we've made everybody jealous for Heal.com, it's relatively new.
Yes.
And it will take time to get geographically spread.
Correct.
Right now, Heal.com is available where?
It is available in San Francisco, Silicon Valley, the greater Los Angeles area, Orange County, and San Diego.
Okay.
Yeah.
With aspirations to hit the whole country?
Yeah, absolutely. Why not? Why can't we drop a Heal doctor wherever you live, right?
Yeah.
How awesome would that be? And to have a doctor coming back to you, to your home, practicing the medicine the way it should be, where the patient is the focus of our care.
Okay, if you're not in California, hang in there. Heal is coming. But if you are in California, you must check this out. It's going to blow your mind. Dr. Kim, anything else you want to add?
No, I just really appreciate the opportunity to come and speak with you guys, and I'm glad that Dr. Berlin, you've had such a positive experience, and we hope to recreate that in every household across the country soon one day.
Yeah, I've done dozens of these podcasts now, and with celebrities and with experts who have written books, and they're sort of celebrities in their own right. I think I'm most excited for this one.
I'm really excited for this.
This is
one,
like
too.
mind-blowing technology.
No, your idea of patient-centered care is something that I've been taught like since I started school, and you are making it happen. And I'm grateful for you and everyone at Heal. And
Thank you.
I think
Go
Angelica's going to start a new
I'm
app. You're going to start an app called like Crack, where a chiropractor just runs into your house.
yeah, or maybe we can incorporate chiropractors in the Heal eventually. You never
Yeah,
know.
I mean, yeah,
There's so
you
much
bring
room
up a
for
lot.
growth.
The potential is limitless. I've thought a lot about integrating such practitioners as lactation specialists,
Right.
behaviorists, nutritionists. I mean, can you imagine dealing with one child or one patient with a multidisciplinary team? That's something that's very hard to put together in the real world, in the outpatient setting, and especially in the hospital too. So you're talking about making care very accessible in so many different ways. And if this is just the beginning, what more can it provide for our patients in the future? That's what's truly exciting. So
I'm excited. If you can't tell. Dr. Samuel Kim, thank you very much for joining us today.
thank you for having me.
And Angelica, as always, great to have you. Listeners at home, check out heal.com online, HEAL.com, or look for the app on the Android or Apple store. It's going to blow your mind. While you're at it, tell your friends about the Informed Pregnancy Podcast so they can make informed choices and empowered decisions too. For more information on today's topic, together with our blog, documentaries, and other pregnancy and parenting resources, visit informedpregnancy.com.